In Lagos State, as I speak, we have accumulated 120 confirmed cases of COVID-19. Of this 120, we still have 87 active cases. We have discharged, fully recovered, 31. And unfortunately, we have had 2 deaths in Lagos State. However, none of those deaths have occurred in the Lagos State facility. 1 patient died on his way to our facility. He was admitted at the Lagos University Teaching Hospital with significant comorbidities, and it was only at the time that we started to recognize what the situation would be. His test came back positive, but before he could be moved to our facility, he demised. There's a second death that occurred in a private facility. Again, he was being treated, and his result came back as his case deteriorated in that private facility, and he died in the private sector. In our Yaba facility, as I said, we have 87 cases, and they're all doing well. Most of them are mild to moderate. Only 2 patients require oxygen, and no one at the moment is requiring ventilation. On that note, I would like to present the cumulative data and analysis of the situation going on in Lagos. This data and our analysis of the data has been very helpful in helping us decide how to plan and what policies to put in place. The data is showing some trends which gives us an idea of the impact of our interventions and also projections and what strategies we should start planning for into the future. I believe some of this data will be very helpful to other states that are beginning to see increasing numbers of cases in their environment. So if you permit me, I'll move on now to a small presentation that will demonstrate some of the data analysis that we have performed in Lagos State. If I may have the front lights dimmed a bit. First slide. Okay, so let's just talk about flattening the curve. We keep talking about flattening the curve. So what does that actually mean? Basically, you can have a very steep rise of cases if you have no interventions. If you have interventions, you can get a flattening of the curve. So instead of seeing most of the cases in a very short period of time, we can see most of the cases over a longer duration. What is the importance of flattening the curve? It's very important that we do everything in our power to flatten the curve for a number of reasons. If we see most of the cases in a very short period of time, it will quickly overwhelm the Lagos State health infrastructure. For example, if we see 5,000 cases in 4 weeks or 2 weeks, we do not have the capacity to cope with that. And most countries in the world do not have the capacity to cope with that. The other thing that happens is that if we're able to prolong the time frame where we're seeing the cases, interventions are coming on stream as we speak. So we're discovering treatments that are effective, vaccines are being developed, logistics is being perfected. So with a flattened curve, there is a greater chance that patients with COVID-19, particularly those with complications, will survive, as opposed to us seeing patients at a very short period of time where we are overwhelmed, we don't have access to the treatment that's coming out from research, there's not enough time to expose people to vaccines, and the overwhelming nature of the number of cases will be seen will mean that we'll have more fatalities in this short period of time. So I hope that's clear, that flattening the curve gives us time to plan, gives us time to introduce treatments, creates the opportunity for possibly a vaccine, and definitely allows the health structure to cope with the number of cases. These are the projections in terms of modeling. The red line is the projection we would see if there were no interventions. In other words, if we did nothing, we would see a very steep rise with thousands and thousands of cases, if not millions of cases. In the blue line, if we just did isolation, contact tracing and isolation, we would see a significant decline in cases because we're interrupting the transmission between individuals. In the green line would be case definition, isolation, and social distancing. And that's what we're doing right now. The green line there would mean we would see much fewer cases because we're contact tracing, we're identifying, and we're isolating. And right now, Lagos is still utilizing that strategy. Our mission is to case identify every possible COVID-19, to isolate them, and to perform contact tracing. There's a fourth line, the black line, and that's the lowest of the lines. That's the preferred trajectory that we would like. The fourth line has an added component, and that component is community ownership, where Lagos State is putting all these strategies in place, but if the community are not compliant, and if the community do not take ownership alongside with government, then we will not see this completely beneficial flattening of the curve. So the government is putting out policies, the government is putting out information, the government is putting out guidelines, but if the community do not join hands and synergize with government, then we will not see the true benefit of all these strategies. So the line that we're seeing right at the bottom, I believe, is the line that we are participating on in Lagos, because there's a lot of community participation, both in terms of civil obedience and in terms of private sector and philanthropic support. So Mr. Babajide Sanwo-olu, to thank the people of Lagos State for being a civil, obedient state and community. Let's talk a bit about the projections. As of the 30th of March, this red line demonstrates the projected trend of the number of cases we're going to see in Lagos State. You can see there that the red line is rising progressively with this slope. As of today or yesterday, you can see that the slope has bent downwards and that we're seeing a slightly lower number of cases per day. We can't tell what the long-term projection will be, but this is certainly encouraging data. What has been seen in other locations is exponential rise of cases, and we are seeing a flattening of the trend. When you combine these two gradients together, this was the original trend of last week, and the red line is the trend of this week, demonstrating that we've been able to flatten the slope of the curve, or as I described earlier on, we've flattened the curve. If we carry on with this strategy, we will indeed see a flattened curve and an improved capacity of the state and of its infrastructure to manage this outbreak without too many casualties or fatalities. Generally speaking, this is the trend in Lagos State. From our index case on the 27th of February, we were able to contain that case completely. There was only one transmission from that Italian gentleman. Subsequently, so that was a dead-end infection. One imported case transmitted to one person, both of them fully recovered, and neither of them transmitted it to anybody else. That index case was from Ogun State. Lagos had its first index case on the 18th of March, and subsequently we had a series of imported cases, mainly from Europe and the United States. We introduced case definition, contact tracing and isolation, and social distancing around the 18th of March. And the trend began to flatten at that point. Our strategy has continued, and we've increased our social distancing awareness, and you can see that there are several points at which the curve is beginning to bend downwards, or the trend, as we describe it, is beginning to flatten. If we had not put these policies and strategies in place, this is the projected modeling that we would have seen in Lagos, while in fact, this is what we are experiencing. This trend, by now, represents at least over 40,000 cases. In reality, we are just seeing slightly above 100 cases. So there's a big difference between the number of cases we would have seen if our strategies were not working, as opposed to the cases that were seen as a result of the multiple interventions that were put in place in Lagos. This is very encouraging for us. It means that at the moment, we seem to have control of the outbreak. We have not peaked, but it is rising at a pace that we can manage and cope with. Let's look at some data. Passengers of interest, we had 2,645. 352 of them have completed their 14 days isolation, and we're still following up 2,293. In the next few days, most of these will exit their 14 days isolation. We're following up 32% at this point, and 68% will exit follow-up anytime from now. Passengers of interest are the persons that have flown into Lagos on a flight where we have identified a confirmed COVID-19 patient. The risk being that being on that flight with a confirmed case, you have been exposed, and there's a possibility that you will manifest with COVID-19. This slide shows you the amount of alerts that we're receiving. In the red is alerts from the public that are diverted to Lagos State from the Nigerian Center for Disease Control. In the green are alerts that are received directly to our Corona, 8,000 Corona number, the Lagos State number. And in blue, it's individuals just phoning me or my permanent secretary or members of the Ministry of Health, alerting us of suspicious cases in community. Out of all these alerts, we have completed and closed down cases of 95% of these alerts that we've received. 4% of those alerts are not reachable, and 1% is still ongoing. So 95% of all the alerts that we received from these sources have been dealt with effectively, and the situation closed out. A breakdown on the alerts or the phone calls. In the top box, you will see that 80% of the calls we receive to Corona, 8,000 Corona or 8,000 Corona, are hoax calls. People calling in to test the number, people calling in to make pranks, people calling in with aggressive language. These 80% of calls are blocking our call center lines and unfortunately making it difficult for the people that really need help to get through. I'd like to use this opportunity to appeal to Lagosians or anybody else that's trying to use those numbers. This is a matter of state and national security. The Lagos State government is trying its best to open up its channels to the community. If you phone us for fun or for pranks or to insult our staff, you are actually doing a disservice to the people that actually need help. 11% of the calls received are welcome. They're asking for information, and they're given information that is satisfactory for their awareness and knowledge. Only 9% of the calls are actually valid calls. Calls that are received from members of the community because they feel that they have a concern. Those 9% are demonstrated in this lower box. While they are valid and require reassurance, only 4% of those valid calls actually results in a red flag. A red flag meaning we need to dispatch members of our team to either test you or to retrieve you to our facilities. So you can see from this data that very few calls are valid, and of those calls that are valid, very few actually meet our criteria for intervention. We are very disturbed about the hoax calls and the prank calls, and this is a waste of resource, and it's the main reason why people are complaining about not being able to get to our call center, because our lines are being jammed by irresponsible members of our society. I'd like to give you some laboratory data. This graph shows you by local government the number of tests we've performed per local government and the amount of positivity in red. So blue demonstrates the number of tests we've performed per local government, and the red bar demonstrates how many of those tests are confirmed COVID-19. You can see that the peaks are in Etiosa, Ikeja, and Lagos mainland. So for example, we've tested 350 people from Etiosa, of which about 10% have been positive. There is a low-lying activity going on in the other local governments, but we are becoming a bit concerned with Alimosho, and I'll give you more data on that in a minute. This slide shows the difference between week 4 and week 5. So we are in week 5 now, and the red was week 4. Week 5 is in blue. You can see that Lagos mainland has gone up from 11 confirmed cases to 19 cases. In Ikeja, we have not seen any new cases between last week and this week. Etiosa has seen a slight increase from 47 to 50. But we're seeing some activity here, even though it's low-level activity. We've seen an increase of 1 to 4 in Alimosho. This may represent a low level of activity, but in line with the density of that local government and the number of people in that area, we're going to divert some of our activity in terms of surveillance, awareness, and information to the local governments around Alimosho. This kind of data is very helpful to us, as it helps us to plan and diversify our strategies and our energies. Let's look at some case management. I've already told you we've had a cumulative number of 120 cases in Lagos as of today. We have 87 active cases. 31 have been discharged, and we've had 2 deaths. This graph shows the changing profile of transmission. At the end of week 4, majority of cases had a travel history, 82%, while 18% had no travel history. As of the end of last week, the number of cases without a travel history has increased from 18% to 45%. That demonstrates that there is more and more local transmission going on, and importation of cases is decreasing. Importation of cases will no longer happen through international flights, but it may happen through marine vessels or through our land borders with neighboring countries, or through interstate boundaries. However, the important information to take away from this is that local transmission is now happening in Lagos State. And the sooner we know about cases in community, in other words, what we define as red flags, the sooner we can come to test you, or if you're unwell, the sooner we can come to admit you to one of our facilities, so that we can contain you and prevent the spread, and also at the same time manage you professionally. So far, 93% of our cases are Nigerians, with 77% foreign nationals. 93% Nigerians, 7% foreign nationals. Our age distribution on this graph shows you that the peak is between the age of 30 and 39, followed by 50 and 59, and then 40 and 49. So most of our cases are between the age of 20 and 60. We've seen very few cases above the age of 60, and we've only seen one case below the age of 10. Once again, most of our cases are male, 67% are male, and 33% are female. This slide shows you the location of our current and proposed isolation facilities. Our main active facility is the Mainland Hospital in Yaba, our infectious disease hospital. We have a total bed capacity of 124, and we're currently at 60% capacity. As we admit patients, we are also discharging patients who are fully recovered. So we're able to cope with the current trend without stretching our Yaba facility. However, because we do not know the long-term trend, we are developing backup. We have the next center to be opened will be tomorrow at the Onikon Stadium. That facility has 100 beds. It will be open to receive patients, and the staff have been trained and given the necessary equipment and preparation to start receiving patients in Onikon. We will manage mild to moderate cases in Onikon and divert complicated cases to Yaba. The opening of Onikon will take a lot of pressure off the Yaba facility and allow the staff there to have a bit more time to manage their cases and improve the clinical attention that the patients are receiving. So the yellow dot here represents the Onikon Stadium on the island of Lagos. Our third facility will be at Bagada, where we have converted the Cardiac and Renal Center into an isolation facility. Construction and renovation is ongoing, and it is expected that that facility will be delivered to us on Friday. If that's the case, we will begin to receive patients at the Bagada facility at the weekend. The Bagada facility has a total bed capacity of 180 with about 50 quarantine rooms. This is indeed very helpful to us because many of the times we have to admit patients whose status we are not sure of. And that's what we refer to as isolation 1 or quarantine. We keep you in those single rooms where you don't have a chance to mix with anybody else until we know your status. If you're positive, then you will move into the isolation wards. If you're negative, then you can be discharged out of that facility. So coming on stream, we have Yaba is active, Onikon is coming on stream tomorrow, Bagada will come on stream by the weekend. We have the Lagos University Teaching Hospital with 60 beds. They're currently making modifications there. So we expect that the Lagos University Teaching Hospital will also come on stream in the near future. We have more backup facilities. Another tent is currently being erected at Yaba. We have another tent being erected at Landmark. And we're currently designing and developing a permanent structure at the Yaba facility, which will hold an additional 300 isolation bed facility. That will not be completed for at least 2 to 3 months, but that will be a permanent structure and not a tent. So in about 3 months, we will have 3 permanent structures. The original Yaba, the new Yaba facility, and the Bagada converted hospital isolation facility. And that's the end of this presentation. I'm happy to take questions now.
Honorable Commissioner, thank you very much. Gentlemen of the press, please, we want everything to be well organized. Asking questions, we want it to be well organized. So if you have questions, just come forward, because we don't want anybody to be confused. So just come forward, you ask your question, you ask your question one by one, then the Honorable Commissioner will take it three in groups. So the first 3 sets we are going to take, then the second 3 sets, then we'll follow after.
Good evening, Commissioner, Permanent Secretary, everybody. I am Mary Alale Yusuf from Channels Television. I want to ask you about the 4% you say that of the contacts that you say are unreachable. Are these contacts, do they represent an open-ended threat? Where are they? Do you know where they are? And what can be done about them? And the second question is, you say the curve is flattening. Perhaps we can do more to help the Lagos State Governor. What is your biggest worry about the behavior of Lagosians which can be amended to help flatten this curve? Thank you.
Good afternoon, sir. My name is Aminat Legushi, health correspondent, Lagos Television. My first question is in addition to what you just said about the flattening curve. Is this an insinuation that Lagos residents can now go about their usual life? Because maybe because of the reports we've been sending out that we are recording, we are having good news in Lagos, and then we are tracing, and people are being discharged because the lockdown, we don't see it being effective. For the past 3 days, people are still going about their ways. In a place like Etiosa, where we have the highest cases we are tracing, there was a huge traffic in that area today. So I don't know what should be done, but on your own part, a huge advice to Lagos residents, what should be done so that we can successfully, combat this? My second question is about the first case, the first death case Lagos recorded. Yesterday, a family organized an event, a celebrity, and then she was arrested and then apprehended to court. This family that had this first case, according to what we saw from your tweets, they did not relate the information they were meant to do. What is going on? The cases, the doctors, the facilities that were exposed to this patient, are they part of the people we are tracing? Do we have any confirmed case from them? And if yes, are this family, are they going to face the law? Thank you.
Yeah, my name is Kazim from PM News. I think my case is similar. You saw on the issue of the lockdown is failing quite all right. Now, I live in Ali Mosho quite all right. As I was coming out this afternoon, everywhere, markets, NAPEP, and so on, they are all doing business as usual, as if there is no lockdown. So what do you think can be done to curtail this? It's extremely worrisome that things are still going right now, because it seems that people are no longer obeying the lockdown, and the police are just there, allow them to go like that. Thank you.
Honorable Commissioner, sir, respond.
So in terms of the contact tracing, those that we say are unreachable, it doesn't mean that we've stopped trying to reach them. We continue to try and find everybody. Where we are not being able to reach them through their usual contact address, we're using our community intelligence and our security agencies to track them down and to reach them. So the numbers keep increasing and going down as we find them eventually, just like we were looking for passengers on our flights. Eventually we find them. So the contribution of our LCDAs and the community development agencies are all on prime alert, and we use those networks to identify people that we're looking for. So you keep asking now about flattening of the curve, and I understand that it's a dynamic. We are experiencing a flattening of the curve. Otherwise, we would have seen thousands and thousands of cases by now. As I said earlier on, flattening of the curve gives us the time and the resilience to deal with the outbreak. When you flatten the curve, you see the same people, or even less, over a prolonged period of time, preventing the entire members of your community from becoming infected. The virus actually wants to infect everybody. What we're doing is reducing its chance and its opportunity to infect everybody, thereby stretching out the outbreak and allowing us to put things in place, including the strategies that I've described and the possible treatment options that are becoming available because of research, and hopefully, if we can get a vaccine soon that is effective, that may be deployed. What is flattening the curve? Or what is contributing to flattening the curve? There are two things. One is for us to identify all the positive cases as fast and as quickly as possible and isolate them. And if they've had contacts, to follow the contacts and keep them in self-isolation in their respective homes. The other thing is social distancing. And there are different aspects to social distancing. There's physical distancing and there's social distancing. So physical distancing just means there's a distance between you and the next person. A virus is unable to jump through the air at you if there's a wide enough distance between you, and if you're not spending your time touching surfaces as you move along. A different degree of social distancing or physical distancing is social distancing, where we limit the congregation of people, either at social events or at places of worship or at areas of economic activity or transportation. So we've put all those measures in place to increase the effectiveness of distancing and limiting the opportunity for the virus to be transmitted from one person to another. The concept of lockdown is to reduce economic activity to as low as possible. However, lockdown has its own consequences. And so what we're trying to do in Lagos is to push economic activity as low as possible to create effective social distancing while allowing our safety nets through the various other ministries in the government to be deployed. And also, while there's less movement in the community, it allows us to contact trace more effectively. It is easier for our staff to move around in a less congested traffic slowdown environment. The effectiveness of lockdown is not within my jurisdiction. There are other members of the cabinet that are working on implementing the efficiency of lockdown. The Ministry of Health is focusing on our business, which is deploying health facilities and health staff. We are working hand in hand, and it is a joint strategy to effectively just slow down the economy so that we as the medical fraternity can carry out our business efficiently, but also, as I said, to interrupt the opportunity for the virus to move from person to person. The death that occurred at Luth, all the staff have been identified. They have been put in self-isolation. They will be observed for the next 14 days. And all the contacts of that patient are being traced as we speak. So that's just irrespective of the fact that he demised. The same strategy carries on. The contact tracing is active, and we will identify all the people that he's been in touch with, and they will be put under 14 days self-quarantine. I'd just like to mention that some of the lessons that we're learning in Lagos as the epicenter of the outbreak in Nigeria, we are sharing with our counterparts in other states, and certainly with the federal government at the Federal Capital Territory. I had the privilege and the pleasure of assisting with the strategic decision-making in Abuja at the request of the Honorable Minister of Health, and with permission from my governor to go to Abuja for 1 day and to be responsible for assisting the development of the blueprint for isolation facilities that will be developed by other states across Nigeria. Lagos has some significant experience in this area, and we're very happy to share that with other states and with our colleagues in Abuja. However, my main focus for now is in Lagos, because this indeed is the epicenter of the outbreak, and it is important that we bring Lagos under control, because if Lagos gets out of control, then it may have ripple effect across the country. So our main focus, and with all the support we're getting from the federal government, from the Ministry of Health, Federal Ministry of Health, and from the Nigerian Center for Disease Control, and from the Office of the Presidency, we indeed, as Lagosians, are very grateful for all that support as we try and contain the outbreak and the biosecurity threat that is happening in Lagos State.
Thank you very much, sir. The next step.
Honorable Commissioner, sir. My name is Dayo Jerindi. I write for Punch newspaper. I have a couple of questions here that I would like to ask you, sir. On the death recorded on Friday, the patient was at a point in Lasut, and I understand some teaching hospitals have facilities to test COVID-19. Why is our own teaching hospital, Lasut, not having the facility to test for COVID-19? Is there any intention from the Lagos State government to make Lasut test for COVID-19? Yesterday, there was a tweet from NCDC saying the Lagos State Bio 3 lab has been activated to test for COVID-19. Is it not the same lab that we've been using to test COVID-19 all this while? Or there's a separate lab that has been used before? Or why is it just being activated by the NCDC if it's the same lab? We also learned that health workers treating COVID-19 patients at Yaba Hospital will be tested today. I want to ask if the result is out yet, sir. Then on the deaths recorded on Friday in private hospitals, I want to ask that are private hospitals allowed or to treat COVID-19 in Lagos? Do they have the facility, or is there any intention by the Lagos government to clamp down on private clinics treating COVID-19 patients? And lastly, during the last press briefing we had here, I asked a question about the Chief of Staff to the President, which you said you don't have an idea of his itinerary. I want to ask, was he at any point in Lagos last week to receive treatment, sir? Those are my questions.
Good afternoon, sir. My name is Ben Asala, I write for The Guardian. My first question has to do, while you were talking, you said that the treatment you're using in Lagos seems to be looking effective. So does this say that we're getting a cure for coronavirus, that you have the right treatment for coronavirus? Two, you mentioned that you will pay attention to Alimosho because there was an increase in the positive case, if I had it well. And because the area is also a populated area, why are you not looking at other populated areas in Lagos, like Ajiromi, Felodu, where you have a number of slums also? Three, the statistics about positive cases for Lagos showed that the highest was 30 to 39, those in the range of 30 to 39 age hold. And that's a different, a shift from what we've had from other climes, where you have the older generation falling down to coronavirus. What do you think is responsible for this? That Lagos is having that statistics. Thank you.
Good afternoon, Honorable Commissioner. My name is Dokumbo Yetunji. I work with Arise TV. Two quick questions. My first one is, do we have any special incentive for the medical workers that are putting their lives on the line for us? One. Number two, do we really have the local capacity to handle this pandemic? I'm asking this based on the plan by the federal government to bring in some Chinese to help us in this battle. Thank you.
Honorable Commissioner, sir.
So we have 3 testing sites in Lagos, and we're looking to activate some other testing sites. The current 3 are the Lagos State Biobank, which is at the Yaba Mainland Hospital, the Department of Virology in Lagos University Teaching Hospital, and the Nigerian Institute of Medical Research. All 3 labs have been testing for COVID-19 for over the past few weeks, but we have just been able to have them all independently validated. There's a difference between testing and validation. We've been testing all along, but when we say validated, it means that the Nigerian Center for Disease Control has 100% confidence that the results that are coming out of those 3 laboratories do not need to go through any retesting. So any of those 3 facilities that releases a result now we have 100% confidence in that result. It's either positive or negative. Sometimes in those labs, they will get an indeterminate result. That result may be indeterminate for a number of reasons. The lab will retest the sample or request a fresh sample. At the end of the day, the result will either be negative or will be positive. There is no midway result. It's either black or white. Those labs are increasing their capacity every day, and we are now thinking about shift work. We can test somewhere between 200 and 300 samples a day, and in the next few weeks, we're going to ramp that up through shift work and the recruitment of new molecular biologists to work on a shift basis. Molecular biologists are not ordinary laboratory staff. They are specifically trained to carry out the genetic testing that is required for COVID-19. It's a very precise test. It requires a lot of expertise. It's not a simple machine that you put a sample in and press a button. It requires a lot of attention to detail in the process of putting the reagents together and monitoring the test. In response to your second question, the Yaba lab is one of those labs that was running tests but has recently been validated. In other words, all the results coming out of Yaba now have 100% confidence. Yes, we are doing some tests on our staff at Yaba. So far, none of them have fallen ill, and we've been managing patients since the 27th of February. So that is testament to the professionalism of our staff and their ability to operate in the environment of pathogens of high consequence and still remain safe. It is true that staff looking after these patients do contract the virus even in the best environment where they have the best facilities. It is the nature of our profession, but we are being very careful to limit this incidence, and if we do find any cases, that we treat them promptly and aggressively. Luckily, most of our staff are young, and this virus seems to run a very mild case, or natural history amongst young people is very mild. Some people will have the infection and not even know that they're infected. The death that occurred in the private hospital is not something that is unusual. Private hospitals are still managing lots of patients with pneumonia, and COVID-19 is just one cause of pneumonia. There are several hundreds of possible causes of pneumonia. So when a patient is admitted into a private hospital with a respiratory tract infection, most of the times it is not COVID-19. So we have to test, and in the process of testing, if it is COVID-19, we would then try and move the patient to the recognized and accredited isolation facilities. We're not encouraging that the private sector manages COVID-19 at this point in time for a number of reasons. It is still an issue of state and national security that cases of COVID-19 are managed in recognized facilities. However, patients with pneumonia may be COVID-19 positive in the private sector, but as soon as we know that they're positive, we will endeavor to move them as fast as possible to an isolation facility. That is not always so easy, especially if the case is developing complications and they are requiring ventilation, as was the case in this situation. It is difficult to move a patient who is requiring ventilation quick, even when you know the result. And that this patient did demise before they could be transferred to our facility at Yaba. There is no cure for COVID-19. If you catch COVID-19, you will either eliminate the virus yourself, or we will give you some treatment that will help you to eliminate the virus, or if you have comorbidity, in other words, if you have a condition that reduces your ability to fight with your own immunity, then the virus may cause organ complication and you may demise from the infection, in which case the virus would have overwhelmed the individual and their ability to destroy the infection. So it's not as if we have a drug like we talk about. If you have malaria, we give you a drug that kills the parasite. We only have drugs that can slow down the infection while your own body's immunity starts to work, and it's your body's immunity that will eliminate the virus. There's a lot of research going on around the world, so it's possible that at some time in the near future, we will have what we may describe as a definitive cure for COVID-19. Indeed, we are setting up our own clinical trials in Lagos in collaboration with other institutions and the Center for Disease Control. And hopefully, by this time next week, we should have started some clinical trials on our patients and on our staff in Lagos State. The reason we're paying attention to Alimosho is because there's been a sudden rise from 1 case to 4 cases. Now, as I said earlier, that's not a big number, but it's a trend. We are following our data. We can't divert our precious resources to where we're not seeing trends. So that's the power of data. When we use our data to disperse our resources, then we are able to pay attention to areas that we think may be becoming hotspots. So we have always had our eye on Alimosho, and now the data is showing that there is a slight but very small increase in numbers in Alimosho. So we're going to deploy increased surveillance and public awareness and education around the Alimosho local government. We will do the same in other areas once our data starts to show some trends that may be early warning signs of things to come. Resources are deployed strategically. We don't just deploy resources across the state, otherwise we may weaken our impact on the outbreak if we dilute our focus on trending areas. Why are we seeing the majority of our infections in the 30 to 59 age group? Well, that is the age group that is most likely to travel, to be mobile, and at the early part of an outbreak, the trend will always be amongst the mobile and the people who are able to move around using air transportation. As the outbreak matures, what will happen is the younger generation will infect the older generation in their environment. And we may start to see a shift in the infections affecting older populations. If, for example, there's a family where a traveler has returned from Europe and is in a household with between 5 and 10 people, and there are some parents in that household, it's quite likely that the elderly parents may become infected, which is why it's important for us to identify these travelers or these early infections and remove them from their households into our isolation facilities so they do not infect the members of their family, which may include the elderly, or infect people in their immediate environment where they live or where they go to transact business. Mr. Governor, the incident commander is in complete control of the incentive packages to healthcare professionals and allied professionals that are involved in the control of COVID-19. Attention has been paid to accommodation, to feeding, to transportation, to hazard allowances, and to special insurance packages. In addition, we are beginning to roll out psychosocial support to all our staff, as our staff are operating under very arduous conditions, very long hours, under a lot of stress. There's a lot of attention that needs to be provided to patients with COVID-19 and to their family members who are obviously and understandably very anxious about the situation. Regarding the capacity in Nigeria, we are all aware that Nigeria, including Lagos State, is suffering from brain drain and that many of our professionals have left our shores. The story around the support that may be provided to Nigeria from the government of China is not unusual. This is not a Nigerian COVID outbreak, neither is it an Asian outbreak. It is a global pandemic. And as citizens of this earth, there is the need for all nations to collaborate to bring this outbreak under control. You are fully aware that people from China, experts from China, went to Europe to assist Italy, France, and Spain. These are well-developed environments, well endowed with medical professionals. And if they can accept support from other countries, irrespective of where that support is coming from, if it makes an impact, then I think it is for the global good. Nigeria does not have the greater experience with dealing with COVID-19. We have some experience in Lagos, but other states around Nigeria may not have as much experience as we have been able to acquire in Lagos State. It is not easy. It is a very complex situation with multiple moving parts. We are certainly short of molecular biologists and scientists, as I explained earlier, and we would not mind receiving assistance from any country that can give us human resource capacity to ramp up our testing so that we can really clamp down on the positive cases in community. An experienced molecular biologist is trained for nothing less than 4 years before they become experienced enough to operate independently. If we're able to get molecular biologists from other parts of Nigeria or from any other country to assist us with increasing our testing capacity, then that offer indeed is welcome, and Lagos would not be turning that down. I am not aware that we are inviting any doctors from abroad to come and assist us. We're only interested in scientists and molecular biologists and logisticians, because 70% of the response to COVID-19 is logistics. Thank you.
Hello, please, let's be well organized, please. Yeah, I believe we have the Permanent Secretary, Ministry of Health, Dr. Olusegun Boye, who has some comments also.
Okay. Good evening. Good afternoon, everyone. There's been a lot of talk about how successful or unsuccessful the sitting at home is. And I think as journalists, I think we need to work harder with the people to understand why it is important that people sit at home. The police have been asked to be nice to people, not to go around beating people off the road. And so it's a bit harder for them to enforce it. But I think you need to let them know why it's important. One, the distancing is creating a break in transmission for the virus. And the second thing, as the Honorable Commissioner has said, is it has allowed us to get around to do what we need to do. We're able to test more people now. We're able to bring more people into containment because the roads are free. Before, we'd be stuck 3-4 hours trying to get across the length and breadth of the state. So I think we need to let people understand why it is important that they stay at home. I don't think we need to depend on the police or the army to beat people into sitting at home. That's what I would just like to ask you all to do for us. And then to thank you very, very much for taking the time to be with us here. Thank you.
Gentlemen of the press, thank you. We appreciate you.